Jason Mwakio has been living with diabetes for the last 15 years now, a journey that has not been a walk in the park. He was first diagnosed with diabetes in the year 2005 when he was 15 years, but ignored follow-up medical procedures. In 2017, his world came crashing when he started falling sick often.
I was young, so nearly ignore. So I used to eat as a normal person. Yeah. Kama ni soda, sukari, hivyo.
For more than 6 months, he was put on dialysis to revive his kidneys functions that were operating at 11%. He, however, had to undergo a kidney transplant since both of them had failed.
I'm saying because like about diabetes, bado iko high because there are some drugs hapa hivi natumia. Unaona hizi drugs natumia ni zinaitwa steroids. So zinafanya kupandisha sukari juu kidogo, lakini nafaa kuzesha kama in the next 2 months.
The 31-year-old former accountant by profession has had to change his lifestyle. His food and social life have since been adversely affected for the sake of his health.
That I'm doing on diabetic food only. Kama sasa kula brown rice kama unga tuko tunaambiwa tunaweza kula ugali afya ama hii ya kusagwa. So everything kama hapa ni brown. Chai
According to the Ministry of Health, studies have revealed that people with pre-existing conditions have high chances of contracting the coronavirus. Diabetic patients are twice more likely to require intensive care than COVID-19 patients without it.
When people with diabetes become infected with COVID-19, then they have a higher chance of experiencing serious complications from COVID-19. And the outcomes are usually not good. And this is even worse for those diabetics who do not manage their diabetes well and experience fluctuating blood sugars.
Every time such details or statistics are shared, Jason can only hope for the best, as he has to be extra vigilant to ensure he reduces his rate of infection.
I keep it safe because every time mimi na mask. Kama vile that is part of my dress code, yeah. So na keep safe, sanitize, unaona ndio ile pia, yeah, kila mtu akikuja hapa lazima sanitize. And then pia unajua I'm limiting friends pia sitembeleagi.
According to data from the Ministry of Health on COVID-19 related deaths, hypertension accounts for 17% of all deaths, diabetes at 15%, while chronic lung diseases are at 10%. Cancer deaths are at 10%, while HIV patients represent 4% of the deaths. Stigma related to diabetes has also made many people avoid patients in distress, especially in public places when they face an attack.
Nimetoka tu nifikari kashua nikiwa gari. Sasa mimi I don't know nimelala. Sasa nika faint kwa gari. So gari ilikuwa nakuja Nairobi, lakini gari ilikuwa inaenda paka huko Uganda sijui wapi. Imagine nilipata nimepitishwa. Hata na mkashina naomba usaidizi. Watu wanaona kama mimi ni mlevi. Unaona sasa vile watu wanaignore. So unapata mtu ameanguka, but people ignore you wanaona huyu mtu ni mlevi.
Acting Director General in the Ministry of Health, Dr. Patrick Amoth, has intimated that the government has worked out guidelines to ensure the continuity of services for people with non-communicable diseases across the country. As Jason walks through his journey of recovery, his hope and prayer is that public sensitization regarding diabetes will be intensified, especially during the ongoing COVID-19 pandemic, with the health implications weighing down patients. Diana Rose, K24 for The Punchline.